Hello everyone, this is your Trichology practitioner, Dr. Leola Day, and what we're going to discuss today is another type of alopecia that we actually see in our clinic a lot, which is the telogen effluvian alopecia, which is kind of under the umbrella of alopecia areata, but the particular type of alopecia that the telogen effluvian has, it happens most common in a lot of women, a lot of men. The pandemic has caused a lot of our patients to be in telogen effluvian due to stress levels. Stress is still the number one cause of hair loss, but with the pandemic, a lot of people did not know how to balance out their physical and psychological, emotional stress with the pandemic. And now with the vaccine, we have still seen a lot of patients so scared and afraid of taking the vaccines due to who they're listening to and not understanding everything about it. So when you're up under a lot of stress, I have a lot of patients who have better issues with marriage or stressful jobs. I tell them I can't tell them what they need to do, but what they have to do is really write down the pros and cons of the situation that they're in, and whatever decision that they make, they have to know how to either get out of the situation, look for another job, also seeing a counselor, a psychiatrist, and to where they can really talk about why they're in the situation that they're in. So, because a lot of times it can be a temporary problem and we make a permanent solution to something, and over time that causes a lot of stress fractures within the actual hair. And so when you know you have a stress fracture, what that does, it actually bends the hair to almost a V shape. So it'll start bending the hair in that position to where it doesn't pop off in the beginning, but eventually it will snap the actual hair follicle in two, and that's where breakage come in at. And it starts from internal. So a stress fracture happens when you start stressing. It start restricting that blood flow, and a lot of time it affects the top and the outer perimeter area of the hair. So that is definitely one of the main things that we have seen within the past 2 years, that the stress actual factor is caused by the telogen effluvian. These are only just a few points. We still have to see a practitioner to make sure. And sorry y'all for the interruptions. Our camera crew had a little accident, but just to continue what we was talking about with the stress fractures, what we have to make sure that we do is that we make sure that whatever that caused us to have the stress, we have to try to figure out how to eliminate that stress. Sometimes some of our patients, they have to learn to say the word no. That's one of the biggest things they have to do. Another thing is menopause. Menopause, and that's a subject within itself, but menopause causes a lot of the telogen effluvian, but we have to know by the numbers, and that's where your physician will have to do a hormone testing. Now we are still trying to get the MD physicians to put the hormone testing in an annual physical for women once they hit over 40, or if they had a partial or full hysterectomy, to where the hormone testing should be a part of their physical. Because when your estrogen levels drop, which is what happens when you're in menopause, what that does, that's a hormonal imbalance, and that will affect the hairline. And so that is a similar of a telogen effluvian alopecia. So can that be reversed? It can. That's where hormone therapy testing results come in, which is a specialist within itself, to where your regular physician can refer you out to a hormone therapy actual physician office to where they can get you on some hormone therapy to bring your estrogen levels back up where it needs to be. Then that way the hairline will start growing back, because now your hormonal imbalance is back balanced. Same thing with men when they are going through, they don't really call theirs menopause. Menopause is another word they can use, that their testosterone drops. So when their testosterone drops, they have a lot of the estrogen that's in there. So what happens with that is that the hair starts to come out. Then they also have some sexual encounters to where the sex drive is not as high as it used to be. And that's because their testosterone levels have dropped. And now we're seeing more men being bold enough to talk about their testosterone dropping, and then they can actually get hormone therapy too, which is taking testosterone shots. So that way they continue to be balanced out throughout as they transition into the other phase of the age. So will telogen effluvium actually have you completely bald? It does not become completely bald. What happens is it becomes very noticeably thin. But if you don't handle what's causing the telogen effluvium, then you can become completely bald, okay? Because what's happening is it'll start as a small circle and it gets bigger and bigger and bigger and bigger. When you see something like that, the underlying issue has not been taken care of. So what we have to do is get to the root cause of what's causing the issues of that type of telogen effluvium and kind of get you back on track. Is it hard? Yes, it is. You didn't get there overnight, so you're not going to get out of it overnight. But you take one thing at a time, and before you know it, you have reversed that cycle of that telogen effluvium, okay? Another thing is childbirth. Childbirth is another thing, because remember, the baby's taking the blood from you. And so after childbirth, postpartum, what will happen is a lot of women stop taking their vitamins. And even if you're not pregnant, you're supposed to take prenatal vitamins when you get 18 and up. Because what that do, that gives you all the nutrients that you're not eating into the bloodstream. And so when people say they're pregnant and they take the prenatal vitamins, they say, well, my hairs really have grown a lot when I was pregnant. It's not because you was pregnant, it was because of the prenatal vitamins that you were taking had enough of the microgram and milligram in it to where it actually fed the hair the nutrients that you wasn't eating. Because what makes the hair come out is lack of the blood that's getting to the actual pore to keep the pore open on its own. So prenatal vitamins always help as one of the any type of alopecia, okay? Major surgery is another one. Being anemia is another one. And what causes anemia is other line issues that cause anemia, okay? A lot of people who have fibroids. Fibroids is another major factor that we have seen a lot with a lot of patients, but that causes being anemic, because the fibroid is taking the blood from the area. Every time you have your cycle, it feeds the fibroid, so that causes low hemoglobin. And so when your hemoglobin drops, that causes anemia. So a lot of people say, well, I'm anemic. Well, you're anemic, but there's something that's causing the anemic. And so you have to get to the point of what causes the anemia, because anemia is just something that it comes with another issue that's causing the hemoglobin to drop. Are you guys understanding? Have any question that you guys have, feel free to put it in the comment, and I can definitely answer those questions throughout. Share this YouTube video to someone who can learn from any type of alopecia. And again, I always say, just saying you have alopecia is not a diagnosis. You have to know what type of alopecia. That way you will know how to tackle it. And you need to go to a true practitioner. So if you go to a physician or dermatologist or trichology practitioner as myself, and somebody say you just have alopecia, you need to get up, go to another physician's office to get an accurate diagnosis. That way you will know how to, they should be able to show you how to tackle that type of alopecia and reverse it. Okay, so today we actually talked about telogen effluvium. Hope this helps someone today. Share, like this channel, share on all of your social media sites. So again, looking at all of the type of alopecia. This is one of the most dominant alopecias out here, which is your telogen effluvium phase. So if you have any questions, leave it in the comment section. I will definitely respond back to it. So hope this kind of opened up a little bit more information, education for you guys on the type of telogen effluvium alopecia. So talk to you soon. Again, this is Trichology Practitioner Leola Day signing off on this video, and I hope you guys have a good day. Be safe and be careful.